On January 20th, Jason Friend, the director of the patient billing office at PeaceHealth, spoke to the healthcare issues team about the types of assistance that are available to PeaceHealth patients who are unable to pay their medical bill. Krista Torres, also from PeaceHealth, was present and answered questions. The following is a recording of that presentation. The recording begins a few minutes after Jason Friend began to speak. Thus, some preliminary remarks are missing. It starts with his slideshow presentation. Thank you for your interest in this.
I guess PeaceHealth Financial Assistance. We're gonna just kind of dive in, and this is broken up by the different programs we offer, and I tried to put them in order of when they kind of come into play in our system. And so the first thing that we do with patients for a hospital encounter, so they come into the hospital for any service, whether this be in the emergency room or like a hospital outpatient, like imaging type environment. We screen all of those patients, or at least offer to. So at the point of registration, we're asking the patients if they'd like to participate in a screening. It's voluntary. Not everybody wants to provide the information, but this is kind of that first introduction that we try to make to patients when they come into the hospital. If they do participate, we gather things like family size and income, and then we let them know the outcome of that based on the information they provided, where they'd fall. Like, would they get 100% adjustment or 80% 85% adjustment? Or maybe we think they don't qualify, but any patient that participates in screening or even chooses to not participate in the screening still has the option to apply for financial assistance. It's just a way to introduce the program, let them know it's available, and let them know based on the screening where they might come out with an approval for financial assistance. And then we educate them on the process for applying, like what needs to be provided to get that application moving and get them the approval to alleviate any bills. So something I didn't mention, at PeaceHealth, we think that everybody in our organization provides some level of healing. And this team, we say, provides financial healing to patients, whether that be alleviating their entire hospital bill or helping them with a payment plan that's more manageable to their individual situation. We try to meet each patient where they're at. So to provide options for them to either eliminate the bill or make it something that's a little more affordable for them to manage on a monthly basis. So that starts again in the very beginning of our process with a screening. So lots on this page here, but this is what happens. So we get the application, the patient provides proof of income. So we really just base it on how many folks are living in the home and the gross income. And based on the outcome of that, we come up with their percentage of the federal poverty level. And we approve folks up to 400% of the federal poverty level. So this is 2024, and I apologize, this was updated Friday, so my screening table is not accurate for 2025 numbers because HHS just came out with the new numbers. So we're in the process of updating it. So it's actually even more generous than what you're seeing on the screen. But to give you an idea, for a single person that is applying for help, up to 60,240 annual or 5,000 a month will get them a 70% adjustment. 45,000 annual income for a family size of one will get them 100% adjustment. So this is the tool that my team uses when they're talking on the phone with a patient to determine where they might land in the kind of adjustment program. And so, like a family size of four, they can get a 70% adjustment up to 124,800 per year in income, and 100%, I'm sorry, 70% for the 124, and for a 100% adjustment up to 93,600 that they could make and still qualify based on gross income and family size. So the important thing to note about the application process is that a patient can apply for this at any time. So if a patient, maybe they don't recall or didn't feel like they'd qualify and they pay the bill, and then 6 months goes by and they get an even larger bill, and now they decide that they want to apply for help and their income has been the same all along, they can retro apply. So they can submit an application and then PeaceHealth would refund them what they had paid. So the program's not on a timeline where you have to apply by, a certain number of days after the date of service. You can really submit that application at any point that's convenient for you. You can do it before your service occurs. You can do it after, and you can do it, a few months down the road if that's what ends up happening for you. Um, to give some context to what our system has given in financial assistance throughout time, I pulled up our fiscal year 24 adjustments for applications across the system. So we did $90 million in adjustments for patients for services that they received. And this is just this one part of the program, and we'll discuss a few others that we have as well. But I feel like that's a substantial impact to communities. So $90 million in care that we provided as a system at no charge to patients. So another kind of piece that ties into that application is what we call catastrophic. So sometimes a patient may not qualify for another program. They might be at 500% of the federal poverty level. And so the kind of example I gave here, so if a patient has a $100,000 annual income, but they don't have insurance, and they get a $200,000 bill, we would reduce that bill down to 10,000 for them. So because we go to 10% of their annual income. So this is for extenuating circumstances where somebody gets this huge bill, can't afford to pay that bill, obviously, because not many families have an extra $100,000 or $200,000 laying around to pick up a hospital bill. But maybe they don't qualify for the other programs. This is kind of an added layer of protection for patients. So they're not stuck with a bill that's not manageable, to bring it down to that 10%. And then, in addition to the reduction to 10%, we offer extended payment plans for those patients as well. So it's not like we're going to reduce it to 10,000 and expect you to pay that all at once. We'll reduce it to 10,000 and then figure out an arrangement that makes sense for you to pay that over time. And internally, right now, we offer interest-free payment plans up to 60 months, depending on the balance. So a patient with a $10,000 balance would likely qualify for bringing that out over time. They certainly don't have to go out that long if they don't want it kind of looming, but they can extend it to whatever makes sense for them and what's manageable within their income.
Jason, may
Yeah.
I ask what constitutes catastrophic?
So really, it's anytime a patient's bill exceeds 10% of their annual income.
Okay, I'm sorry,
So,
I didn't see
yeah,
that.
yeah.
Thank you.
So, those larger bills that come out, and oftentimes we find that with the uninsured population. So, that bill exceeds that 10% threshold. And we do have another uninsured discount that I'll discuss here in a moment, but there are multiple things that happen to help get that bill down to a place that's manageable for folks. So presumptive financial assistance is another piece that's really important to note in our process. So um, we kind of talked, a lot of patients don't realize that they qualify. So if I back up a few slides, a lot of folks with an income over 100,000 a year don't assume that they would qualify for any help. And so they don't participate in the application process. Though, like we mentioned, we screen them, so we let them know at that point it's available. We put applications and information on each statement. So every statement a patient receives from us has not only information about financial assistance, but a copy of the application to encourage them to apply. But we still have patients that, for one reason or another, just will not comply with the process. They don't want to apply, whether it be they assume that they don't, or they don't qualify, or they feel like it's a burden and they don't want to put that bill on someone else. So through all those educations, if all of those attempts fail and we can't get the patient to agree, we run patients through a tool, which reviews things like just kind of their income based on bills that they have with other areas. And then if the patient is likely to qualify for financial assistance based on the information we have, we provide this, it's called presumptive. So we're presuming that they would qualify, and we alleviate bills for that as well. So we've sent them the 4 statements. We've done all of the notification process. And before we send somebody to a collection agency for that bill, we're screening them to see, do you likely qualify for help? Because if so, we don't want to send you to collections, so we adjust the bill at that point. Context here across our system for fiscal year 24, which ran from July of 23 to June of 24. We gave just shy of $64 million in free care for that category. So we reduced those bills and alleviated that for patients on this presumptive financial assistance program. Right. And then another program that we offer, and this has no income qualification. So every patient qualifies for this regardless of their situation. If they don't have insurance or if they are receiving a medically necessary service that their plan is not going to cover. So maybe it's a procedure that is medically necessary, but for whatever reason, their Blue Cross Blue Shield plan says, well, we exclude that from coverage, or there's just some reason that the health insurance does not want to pay for that. We offer the discount to those patients as well, even though they're insured, because in that context, they don't have insurance to cover a procedure. So for a hospital service, it's a 35% discount off of the charge. And that's again for every patient. And for professional, which means more like the physician services that are provided throughout that, that gets a 25% discount. So again, every patient qualifies for that if there's no coverage. And the total care that we provided discounted for that was $57,987,000. So just shy of $58 million in care that we didn't charge for, that was due to one of these uninsured discounts.
That's amazing.
And so this just kind of recaps. I like this because it puts context into how many individuals are being helped, as well as how many dollars. So the total, when you include the uninsured discounts, the catastrophic, the presumptive program, and the regular application process across our system, it was just shy of $212 million in fiscal year 24 that we provided in free care to patients. And that spanned over 90,000 patients. So, again, it's interesting to consider that we provided this to 90,000 patients, but there are still patients that don't participate and don't get picked up somewhere. So that's why we're always willing to educate. We want to make sure that folks know about the program, they understand the income thresholds, because a lot of people don't believe that they would qualify. But when you look at the screening algorithm, many do. And so we want to make sure that if they qualify, they're being provided that. And, Krista, you touched on this earlier, and I didn't bring it up, but it's important to note that outside of the uninsured discount, the fact that you have insurance or don't have insurance doesn't come into play. So you don't have to sign up for Medicaid to get this if you're uninsured. And we found that with a lot of our like immigrant population that are working to get citizenship, they're fearful to apply for help in this. They don't want to apply for Medicaid because they're concerned about what the outcome for them might be if they do that. This program does not, this is independent of any Medicaid application or any government program. This is PeaceHealth's program. So we're providing this to the patient. It's not being going through anyone else or reported out anywhere outside of the dollars and the high level detail of what we provided and the number of patients impacted. So trying to encourage folks to participate if they can. We also work with the Free Clinic of Southwest Washington, and we have some programs there where they refer patients to us, and that's another avenue we can educate folks about this program. But the more we can educate and the more we can bring this to light for patients, the more we can serve the population. And I always kind of liken it to this. If you get on Medicaid, that's amazing for a patient that's underserved, because we can only help within the walls of PeaceHealth, and Medicaid will help them get things like prescriptions and go see another provider for follow-up care, things that we can't always provide in the walls of the hospital. But if not, I'd rather them get on the financial assistance program and do more maintenance type things with their health, because oftentimes what we find is patients wait and then they end up with one of those catastrophic bills where it could have been solved with a urgent care visit early on in the process. They waited until it became a more dire circumstance, and then that bills more because of the channel in which they're coming into the facility. But really just, again, highlighting these programs, making sure that everyone on this call at least is on the same page about what we're providing, the different ways that we're trying to communicate this, and If I encourage you, if you've got friends or family that are struggling with the bill from PeaceHealth, encourage them. Please, apply for this. And there's no ding or anything negative about applying for help. Even if somebody doesn't qualify, it gives them a gauge of where they're at in the program and process and makes them aware of any other programs that might be available to them. So yeah, that's what I've got to share, and I'd love any questions. And Krista, if there's anything that you wanted to add, please do. But
you did great, Jason. I think the only thing I would emphasize is I think that I think is very important is that many people don't think they qualify because they have some form of insurance. So if I were to stress anything, it's super important that people understand that doesn't mean that you can't have help with the out-of-pocket portion that insurance didn't pay. And I can't stress that enough because oftentimes people don't think they qualify because they have some sort of coverage. And that just isn't the case. But yeah, let's entertain questions.
yeah, looks like Julia maybe
Okay.
it's the first hand up.
Yeah. Hi, thanks for coming. I appreciate your information. Does this benefit or does this these opportunities extend to clinical visits? Because I know PeaceHealth, provides a lot of clinical visits outside of the hospital walls. So is this only a program that's applicable to hospitalized treatments, or is this also extended to the clinical? Like
Great
PeaceHealth
question.
cardiology, PeaceHealth,
Yeah.
Osteo, PeaceHealth this and PeaceHealth that. So, because that's where more people, if they don't have a hospitalization, because our insurances don't want us to avoid hospitalization at all costs. So many things are done on the outpatient basis. So does this program extend to that?
Yeah, great question. So I'll answer that two ways. The screenings that we provide, those are happening in the hospital, not always in every single clinic. It's like the PHMG is what we call that. When you apply and are approved for financial assistance, that's all PeaceHealth services. The only exclusion piece to that, I think, is medical equipment. So if somebody comes in and needs a CPAP, uh, let's say in a sleep clinic, because we're buying that hardware from someone, so we're not able to then give that. But all of the services, so injections, medications that we provide in that context, all of the clinic-based services are covered when you're approved for financial assistance.
Is there any plans in place to educate the public? Because if you're not hospitalized, so many people go to those clinical visits, they may not be aware of that. So it sounds like the screening is really well thought out in the hospital aspect, but not so much in the clinic. So is there any plans to extend that to a clinical visit?
Well, so for the clinic piece of it, when you get a bill for your clinic services, it comes in the hospital bill. So we use one billing. So all of the information that I mentioned that we provide to patients also comes for their clinic bill. So it's kind of noted there. In addition, the folks at the clinic are educated on financial assistance. So if a patient says, I'm really struggling with the bill, they can inform them about the program. So I think, yeah, they're educated in the clinic. The actual screening piece is just they would refer them to, if the patient came into the clinic and said, I want to be screened for financial assistance, they would refer them to our call center, and anyone on my team that would answer that could screen the patient there as well. But it's not exclusive to just hospital. It does cover clinic visits and services as well.
Okay, and that includes, I don't want to monopolize the time here.
No,
but I
you're
am
okay.
a former healthcare professional, now retired. So I have a lot of, because I work with patients in this aspect. So my question also, how does in the clinical environment, how does this extend to screening services? Because, and Kathy working for the Opportunity Council might understand this, that a lot of people, because the information is not out there, withhold screening. So by the time we see them in the clinical environment, they have really advanced stages of disease processes because they weren't aware of some of these screening that might extend to them. So it just goes back to how do we get the word out that people can have access to the screening they need.
So when you say screening, are you let's say preventative mammography with
or a cervical pap smear, or all these things are really preventable before they get to high stages of degree of illness.
Yeah. So, and for an uninsured patient, I can give you kind of a context here. If an uninsured patient were to call and schedule a preventative PAP, we would provide that patient an estimate at the time of service. So like when we schedule, right? So we're the No Surprises Act says we provide them for any scheduled service that's scheduled 3 days or more out. We give them an estimate, and on that estimate letter, it also includes information about our financial assistance program and how to get more information, who to call. So we do, in many fashions, provide information and ways to get connected with financial assistance, even for clinic encounters that are scheduled.
Yeah, I just wish there could be a way that, because I think a lot of people just don't go because they'd say, I don't have insurance, I don't have any money,
Right.
and I'm
Right.
just gonna ignore any of my symptoms. And then again, they come in the ER or whatever, and then we find that they have advanced stages of illness. So I think it's just communication thing.
Yes.
Yeah.
Yeah,
And more community outreach, right? So we, like I mentioned, we do like in public health areas, put panel cards out to try to inform the public of, hey, PeaceHealth offers this program. And then presenting to groups like yourselves to say, hey, this is out there. So if you happen to hear a conversation, because I think a lot of this has to come by word of mouth. The information's certainly there if somebody searches for it, but knowing to search for it, I think that's
Right.
kind of what you're getting at, is how does
and
somebody know?
even
Yeah.
physicians who are the touch point and nurses, they're not well informed. So I think physicians are the touch point, and the clinical staff, whether it's hospital or on-site clinics, would be the touchstone and have that available. And maybe we could be a part of that, getting the information out. And I won't keep going, but one more point. I am impressed. I had no idea that that was the amount
Yeah.
that was spent, and that is a big number.
Right.
And so, it's very mind-boggling that PeaceHealth can continue to exist financially with this kind of payouts, which is a great thing. I'm very impressed by that. I had no idea it was that number. So anyway, thank you for your answer. I'll be quiet now.
Yeah, absolutely. Thank you for the question.
Sure.
If I can add one thing to what Julia said, I think maybe the problem, maybe people may not know what screenings they need. I try to keep on top of what's appropriate for me, but not everybody does that. Do they
Right.
know that they need a colonoscopy? Do they know they need a pap smear? Do they? And if they don't know that, if they don't come in for just a general preventative appointment, they aren't going to find out what these appropriate screenings are.
Right. I would agree totally. I think, this is Kathy, in my population of people, and Julia, this goes back to your comment, people are afraid because of the cost. And so they just think, "Huh, okay, I don't have to do this. There's nothing wrong with me right now. So why would why would I have to incur a cost when I feel okay?" But to Julia's point, I think that getting the word out is so important. And this is one of the reasons why I wanted to take this class is, I teach financial education to people through Opportunity Council. And this population is probably 99% qualified for these programs. I also sit on the board of Whatcom Asset Building Coalition, which I think is another organization that could utilize some of this information to get out to the public. We're actually doing a seminar in May, and this like Julia said, and the numbers just blow me away. Jason, I have a question for you, if you don't mind.
Sure. Yeah, please.
Okay. What's the time frame between PeaceHealth trying to collect a bill and the time it gets sent to a collection agency?
Yeah, great question. So it's 120 days
Okay.
is kind of the standard, and that's assuming everything goes perfect and nobody calls us to inquire or dispute anything, because that can obviously delay it. But we send
Right.
4 statements. The first one is usually around the beginning of the time frame that somebody has the bill dropped to them. So insurance processes and says you have a 20% co-insurance. And then it's every 30 days throughout that process. And then once the last statement comes out, number 4, then it's another 30 days from there. So 120 is the total time frame typically.
Okay, if I may add something, which I think is very positive to our consumer population, the Fair Credit Reporting Act requires information about you to be reported to the credit bureaus, which includes collection agencies. Medical collections is the biggest pain for most people because it was something that they accumulated without wanting to, right?
Sure.
The CFPB, the Consumer Financial Protection Bureau, just made a ruling last week that all medical collection data will be removed from consumers' credit reports. And I think it's supposed to happen in the next 3 or 4 months.
So Kathy,
Which,
good news is, I'd love to jump in here because this is something I'm really, really proud about. And this is something in my previous 2 institutions that I also was advocated for and successful in many walks on this. We do not report to credit agencies, to collection agencies. PeaceHealth has a longstanding history of not affecting people's credit for their outstanding medical debts. So that's another one of those areas where we were ahead of legislation on that. I think I read that as well and was thrilled that finally everyone is going to be held to that standard. Nobody's life should be affected. Their ability to rent a home or any other thing should be affected by whether or not they have paid medical bills. So that's something I think is going to be wonderful across the entire nation now that
right,
everybody is going to be held to that same standard. But rest assured, PeaceHealth, and we have contractual arrangements with anyone that does external collection activity for us, and they are forbidden by contract to report that to credit bureaus.
really, I have never heard of a hospital doing that. That's amazing because
Very
the
few nonprofits do that to patients, very few. I worked for Sutter Health on the West Coast for almost 20 years. No reporting to credit agencies. Same with Banner Health across the Midwest, no reporting to credit agencies.
Wow, okay. So the normal person who incurs medical debt is going to take a hit and with this new law passing, their credit score could improve from 50 to 100 points, depending on how much medical debt is being removed. So that's a huge impact to people who are trying to rent or buy or do whatever. Thank you for that information, Krista. That's amazing.
We also, just for context, we don't allow our collection agencies to pursue any sort of legal action against anyone. So it's both credit reporting is not allowed, legal action, which ties to garnishments.
No wage garnishments, no lien.
Yeah.
Not engage in that behavior.
Wow, that's amazing. Yay for PeaceHealth.
Sherry, I see your hand up.
Yes, thank you. And good presentation. Thank you, Jason. And I, like Julie, was surprised at how much is forgiven for patient debt by PeaceHealth. But I was also looking at the the IRS form and the Loan Institute, and it estimated there that PeaceHealth spent over 108 million less than their community investments than the value of its tax exemptions. And I'm wondering if either you or Krista explain that.
Krista, I know that Community Health does as a whole different team that does the investment for spending floor. I don't have any details on that. I don't know if you do offhand.
I'm surprised by that, and I have not read that similar information, Sherry. I would be happy if you could send me that to have others look into that. It wouldn't be appropriate for me to respond. It's not something that I have heard, and I would find it incredibly unusual given that, like these numbers Jason presented, these go up every year, not down, et cetera. So, and then
I was surprised too.
Yeah, yeah, I would love to take a look at that. There are sometimes studies out there, like I've had some experience with the RAND studies, for example, where there are materials presented that get taken out of context. So it just all depends on who's presenting and what are they grabbing and what are they comparing to, and that I just can't speak to without seeing it.
Krista,
I'll
could
send
you,
it to you. Thank you.
could you provide your email address,
Yes.
Krista?
Happy to. K,
Mm-hmm.
and then my last name, T-O-U, R like Robert, O, S like Sam, at peacehealth.org.
T-O-U.
I
Maybe
want you
you
to
could-
run that by one more time, please.
Yeah, really.
Or maybe you could put it in the chat.
I'm gonna type it in the chat.
Good
Yeah,
idea.
That would
I'll
be
type
great.
that.
Thank you.
Yeah.
I got stuck on the T-O-U.
I did
The
too.
quality of the audio on my computer is poor. So when people spell things out often, I can't hear them correctly.
Thank
Thank
you.
you.
Siri
I-
never understands me either when I ask for help, so I get it.
No, Jason, I was wondering when you talk about the payments over time to make it easier to pay off the entire bill, is there interest on those payments or
No.
on the unpaid bill?
So up till a few months back, we did use an option for a loan vendor that did charge interest. We've moved away with that from that. So going forward, there is no interest to patients for setting up any sort of payment plan. Also, just for context, historically, if a patient qualified for, let's say, like a partial reduction by financial assistance, so one of the 70 or 85% reductions, and had a bill that they wanted to spread out over time, there was no interest to those patients. It was really only patients that didn't qualify for financial assistance but wanted to spread their payments out over time. Then there was an interest-bearing option, but we made a business decision, like I mentioned several months back, and now those are all offered in-house. There's no third party, and there's no interest to anyone for those payment plans, for any payment plan, regardless of if you qualify or not.
That's amazing.
Particularly if you're spreading this over 5 months or 5 years, that's
Yeah.
60 months would come out. The cost of money, it actually costs the hospital
It does, yeah.
system to do that. Yeah. Are there any other questions? If not, I've got a couple of questions I got in email that I'll go to, but I want to make sure everybody who's here had a chance to ask any questions they might have.
No, thank you.
Okay, let me see if I can paraphrase this because they were part of a long email, different emails, and see if I can ask the question as the person was trying to ask it. There was a change to I guess it was a year or so ago. This person was talking about it. There had been the state attorney general fined PeaceHealth and several other hospital systems because they were not meeting charity care requirements. And this person was wondering what kind of changes that may have been made in response to that.
Yeah, great question. I can speak to that. So a lot of that kind of went back to the screening of patients, right? So when a patient came in, were they being offered a screening? We were informing patients that we had a financial assistance program and offering more information, but missing a step on like the actual, hey, can you give us your family size and income? So that's one of the big pieces that we implemented across the system, was to make sure that at that point of registration that a patient was offered an opportunity to be screened and then informed of the outcome of that screening. So the experience now after that is that when a patient comes in, we're not only letting them know that financial assistance exists, but they're actually offered an opportunity to provide someone family size and income, and then be informed in writing of the outcome and how to apply. So really trying to be more transparent with whether or not you would qualify for financial assistance or not, and providing like all of the details for application right at that point of registration and in writing as well.
Have you seen a change because of that, because of the increased information that's available?
I think we've seen a slight uptick in folks applying. I think it brought a little more light, like allowed more people to see, hey, there is a program, and maybe they would have heard about the program at the point of registration before, but then not followed up on it or pursued it. So I think when somebody chooses to participate, right, so we offer them the screening and they choose to provide that information to us, because we can't force somebody to give us their family size and income, and many don't want to. But when they do and they can see, oh, I thought I wouldn't qualify, but I'm actually, based on what I've given them, 100% qualified. I don't have to pay anything. Those are the patients that we feel like we're catching that are saying, oh, okay, I thought I didn't qualify, but I in fact do. And now I'm going to apply. And so, yeah, I think that's the big change that we've seen is more people knowing that they do qualify ahead of time and then choosing to sign up for our financial assistance program.
What if you come into the emergency room?
So I will kind of say this with the caveat that in the emergency room, it very much depends on condition, right? Because not everybody that comes into the emergency room we're able to speak with, trauma scenarios, things like that.
Right.
But somebody that just comes in, let's just say they've got pneumonia and they're in the emergency room, they're in the right place of care for their situation. Those patients are screened in the emergency room or offered that screening as well. But I
Okay.
don't want to say every single patient
Right.
because it's not feasible based on condition.
Thank you.
This email question might be a little bit out of your area. But she was wondering when the state or whatever whatever is considered charity care, what is considered charity care? The and she said the IRS definition included a lot of things. What is the definition of charity care that the Attorney General might have been using? Uh,
Yeah, I I'm not 100% sure, kind of the context there. For us, the things that we bucket are what I've shared today. So that presumptive screening, somebody that applies the uninsured discount and that catastrophic program, that's what we put into the bucket of charity care. Um, so Chris, I don't know if you would add anything to that, but I mean, as far as what the Attorney General's using, I think it's kind of tied to their RCW that outlines charity care and what you can ask for to apply. Um, I don't know if that's helpful or not as an answer.
I do realize this may be more the accounting part of the business rather than
Yeah,
what you're doing, but
it is
she
kind of
did
how they
ask.
tie the adjustment codes together, what we put in our system versus what's reported out on the tax return piece of it. But yeah, I don't know beyond that.
Yeah, and there is some difference there. We have, for example, there's a place that incorporates our Medicaid, which is really another form of underinsurance and such. It's complicated accounting. I'm glad I don't have to do that part of it. We have a controller at system who does that part of it. I see the big files and the calculations for everything that goes into it. And the other thing too that there's charity care and there's community benefit. So we have, community benefit is a whole nother arm of the organization that harvests and supports other community programs. We make a lot of donations to other nonprofits, other community programs. So that and participate every 3 years as mandated, right? This is an IRS requirement to participate in a community health needs assessment. I think this year is the year of the renewed community health needs assessment. And so like Kathy, for example, she's with Opportunity Council, may have met Rachel Lucy. Maybe many of the rest of you have met Rachel Lucy. She's the head of our community benefit programs here in Whatcom County. And out there, very visible and working with a lot of other nonprofit organizations. So there's that arm as well that's part of fulfilling our charitable organization, purpose in our communities. So definitely all much more than just what we do for financial assistance. There's a whole nother arm of charitable contributions that help that really all nonprofits are part of.
That may have been really the question she was asking it in her email. You mentioned the health needs assessment was going on. Will that be publicly available? that sounds very interesting. Like it would be very interesting to our members.
Yeah, it ends up, the community health needs assessment ends up published on our website, without a doubt. And Rachel Lucy would welcome the opportunity to come and speak about the community health needs assessment and the findings and such. She would be more than happy to do that. She heads up that effort. And I know that she would welcome the opportunity. And that's really awesome for spreading awareness of what are the top identified needs in our community. And what are we doing to address those top identified needs in our community? So she is fantastic, and knows it very much in depth and leads that effort every 3 years. She would be more than thrilled to come and talk to it.
That
Is-
does sound interesting. Do you
Yeah.
know about when this would be published on the website? Is this
There's always one out there, whether or not the one that was, I think it's this year that there'll be the new one, and I haven't gone out and looked, but the most recent one that's been published will be there. There's always one there.
okay?
And then it's good for 3 years. So depending on depending on the date on the one that's out there now would be whether or not it's the most current one. I'm not for certain without looking.
Okay, I'll go out and check that out and be watching for it. Thank you.
Can- Krista,
Jason,
can you provide Rachel's email?
Yes, I'll look that up real quick and I'll put it in the
Okay.
chat.
Okay, sorry, that's all.
Julia, I see you have your hand up again.
Well, is my mute off? Yeah. So I have our fairly new, well, 2 years now or more, paper, the Cascadia. I think that this would be a great opportunity to share some of this information that we've heard today. And I think they would be open to knowing and understanding what Jason and Krista have shared with us today. I see that as a nice tool for the community because, I worked for PeaceHealth for 10 years and I'm learning this myself right now. I've been retired now for a while, but so I think just getting that out to the community, because unfortunately PeaceHealth has had some bad raps happening in the news lately. And I think that this would be a good PR thing for PeaceHealth. I'm guessing that there's probably a main person that you have to go through. But just a thought that I think this would be valuable information that could boost the whole perspective that people might have about PeaceHealth. So I just thought I'd share that.
Thank you for that, Julia. And you may already be familiar with Amy Drury. She's the head of our marketing and public relations here in Whatcom County. And I do think that they have come up with, I think, a simple one-page document that's able to be shared. But I will put her email on here as well.
Jason, I was wondering when you talked about the discounts that are calculated on the bill, is that the billed amount where the discount comes from? I would imagine it is, because if there's no insurance, there's no discount from
So,
the.
well, there's a couple of ways that that's calculated. So if there's no insurance, then yeah, it's just off of the charge. But let's say that you have a 20% Medicare co-insurance that you're responsible for, then what it actually discounts whatever the patient is responsible for. So if you had $100 charge, just to keep math easy here, you owed 20, and then you apply and you qualify for an 85% discount, we would discount that $20 by 85%, and you would just be responsible for the remaining 15. So I guess the answer to that is it depends on if you have insurance and what your particular patient responsibility portion is. But that's what we're applying it to, is of whatever the patient owes is the discount amount that we're applying.
Yeah, because when I get a bill, I get very different amounts on it.
Yeah. Yep. So it's whatever that amount is that you owed personally, then and obviously if you're uninsured, it's the full amount. If you're insured, then it's a partial amount. So we apply it to whatever the patient's portion is.
Okay, thank you. So are there any other questions here? I don't see any hands up or anyone waving their arms or anything. Okay. Then I'd like to thank both you, Krista and Jason, for coming and letting us know about this. This is really helpful. This has been recorded. It will be up on our website. It seems to take about 3 to 4 days in order for it to get posted up there. And certainly I will send out emails to all our members. There's over 100 people who receive our emails, and let them know that it's up there and about this information, because this could be very critical. I think there's people out there who are avoiding scheduling appointments, screening appointments, preventative appointments because of financial reasons. They're very concerned about that. Thank you very much for coming.
Yeah.
Very
Thank you for
Yeah,
having us.
Thank you very much for doing this. It was wonderful.
Yeah.